Breaking bad news. It is one of the communication skills which health professionals should have, and they find it very difficult to have appropriate skills for breaking bad news. I will try to present this in very simple forms. There are just a few steps, important steps, and these might make it easy for you if you practice how to break bad news. The first thing is check with the person whether they would like to know. Surprisingly, some people would not like to know, but a lot of people would like to know. Once they like to know the information or the diagnosis or the prognosis, check how much do they already know. Now that is very useful because if they already know, your job is easier. If they know partially correct and they have some misconceptions, you can correct it. But if they don't know, that is the difficult part. So if they don't know, you should give something like a warning shot or a hint or an indication that you are going to tell something very serious or that the person might be having something very serious. And after that, give a pause. During the pause, the person is usually in a shock after the warning shot, and after the pause, you can check whether they would like to go ahead with the conversation or not. If not, then you postpone everything to the next session with them. But if they would like to know, then you provide them with the information about the disease or medication or prognosis in simple terms and in short sentences. After every few information that you give, check whether they have understood or not, and then give more information. Again, you check whether they've understood or not, and how are they feeling about it. Are they getting too distressed? Are they getting too anxious? And in which case you can reassure them, and then talk about what are the other issues that they might be having. Simultaneously tell them about a plan, about what will be done now that the diagnosis has been made, and then check whether they have understood or not. So these are the few steps, brief steps, but like I said, it might sound that it is in a very short segment, but it might take a few minutes. In the end, check with the person whether they have any questions, and also assure them that you are there to help them and cope with the disease as far as possible. So try out these skills, and then it comes with practice, and it will be in the end satisfying for you and satisfying for the patient or the caregivers or the relatives.